Good morning, everybody. Pleasingly, New South Wales has satisfied another important hurdle. 75% of our state have at least the first dose of vaccine, and we will all rest easy once we get to at least 80% first dose, knowing full well that we'll hit that double 80% vaccination rate as soon as we can. 42% of our citizens are fully vaccinated, a number which is very pleasingly inching towards that 70% double vaccination rate we're all looking forward to, which we still estimate will be around mid-October. To 8 p.m. last night, there were 1,480 cases of community transmission and regrettably 9 deaths, and we extend our deepest condolences to the loved ones of those people who lost their lives with COVID. Dr. Gal today will in particular highlight the suburbs where we're calling out people to come and get vaccinated. It's really important for us to move forward, and whilst parts of Western Sydney and southwestern Sydney are demonstrating outstanding results, there are other parts of Greater Sydney that we'd like to see the vaccination rates go up, and Dr. Gal will call some of those areas up. And there are also areas where they join some of these communities and might actually be at risk of having more cases in the next few weeks, and we want to make sure that people are protected all around the state, but also that we all move forward to ensure we get those vaccination rates as high as possible. Very pleasingly today we have with us Professor Christine McCartney. She's a specialist at Sydney's Children's Hospital at Westmead, as well as a number of other important roles, and she's going to allay any concerns about the impact of Delta on children and how parents and children can move forward, especially with schools returning next month. And I really want to thank Professor McCartney for the great work she and her colleagues do, but also for the time today, which we know what a struggle it's been for families who are home learning, for parents who are overseeing home learning, as well as undertaking their own work responsibilities and household responsibilities. And we just want to say to everybody, thank you for your patience, and please have the opportunity to hear directly from an expert as to what Delta means for children, especially those under 12. Dr. Gal will now give the health update. The Deputy Premier will talk about the regions, and as we've foreshadowed, we'll be talking about what it means, what the future of lockdowns mean for regional New South Wales later this week, and then Professor McCartney will give her update. Thank you.
Thank you very much, Premier, and good morning, everybody. Till 8 p.m. last night, there were 1,480 locally acquired cases of COVID-19 in New South Wales, and there were 0 overseas acquired cases. We had 130,341 tests reported till 8 p.m. last night. So again, very good testing numbers, and thank you to everybody coming forward promptly for testing if you have even the mildest of symptoms. Currently, there are about 11,000 people with COVID-19 who are being cared for by New South Wales Health, and the vast majority of those, over 90%, are being cared for in the community or in New South Wales Health's special health accommodation. There are currently 1,136 people with COVID-19 admitted to hospital. 194 people are in intensive care, and 78 of those are currently requiring ventilation. Of the 194 people in ICU, 158 are not vaccinated. Sadly, today we are reporting the deaths of 9 people with COVID-19. They are a man in his 60s from Dubbo who died in Prince Alfred Hospital. He is not vaccinated. He was not vaccinated and had some significant underlying health conditions. We also report the death of a man in his 90s from southeastern Sydney who died at St George Hospital. He was a resident of the St George Aged Care Facility in Bexley, where he acquired his infection, and his death is the 3rd death linked to this aged care facility. We're also reporting the tragic death of a man in his 20s from Western Sydney who died in Nepean Hospital. He was not vaccinated and also had serious underlying health conditions. We are also reporting the death of a man in his 80s from southeastern Sydney who died at Prince of Wales, a woman in her 60s from Western Sydney, Agnes Banks, who died at Nepean Hospital, a man in his 70s from Western Sydney who died at St Vincent's Hospital, a man in his 80s from Western Sydney who died at Westmead Hospital, a man in his 70s from southwestern Sydney who died at Liverpool, and a man in his 40s from southwestern Sydney who also died at Liverpool Hospital. 7 of the 9 cases of people who died that we're reporting today were not vaccinated. 1 person had had 1 dose and 1 person had had 2 doses, and all those individuals had underlying health conditions. On behalf of New South Wales Health, I do extend my deepest sympathies to the families of those individuals who have lost their lives. Today I'd like to draw attention to a few areas for people to come forward for vaccination and for testing and to be aware particularly of symptoms. We've had a sewage detection in the Bonny Hills area of the mid-north coast. We're currently unaware of any cases in the Bonny Hills area, so if you do live locally, please be aware for symptoms and please come forward for testing. In terms of our suburbs of concern, we remain concerned about suburbs that we've previously mentioned in the Western Sydney and Southwestern Sydney area, and we encourage residents of those areas to come forward for vaccination as soon as you can. We're also concerned about case numbers in the areas of Glebe, Waterloo, Redfern and Marrickville, and I'd like to encourage the residents of those suburbs as well to please come forward for vaccination. The Sydney Local Health District has set up some special clinics, Pfizer clinics, where bookings can be made or walk-in appointments can be made for residents of those areas. And they are clinics at the Peter Forsyth Auditorium in Glebe, the PCYC in Marrickville and the West Leagues Club in Ashfield. So please, if you live in those suburbs, come forward to get vaccinated. Please look out for symptoms and get tested if you have even the mildest of symptoms. I'd also like to thank all residents of those 12 LGAs of concern in particular for coming forward. We're really seeing great vaccination numbers from people in those areas, which is fantastic. And I'd particularly like to ask people who live in suburbs around the Liverpool area and the suburbs around the Parramatta area as well to come forward for vaccination. So thank you very much.
Good morning, and could I start by offering my condolences to those families that lost loved ones. You remain in our thoughts and prayers. Up to 8 p.m. last night, Western New South Wales Local Health District, there were 27 new cases. 17 of those cases were in the Dubbo local government area, 6 in Burke, 1 in Walgett and 3 in the Bathurst local government area. In the Far West Local Health District, there were 7 cases. All 7 cases were in Wilcannia. In the Illawarra Shoalhaven region, overnight there were 34 cases. 24 cases were in the Wollongong local government area, 7 cases in the Shellharbour local government area, 2 cases from the Shoalhaven local government area, and there's 1 case currently under investigation in the Kiama LGA. In the Hunter New England Local Health District, we had 11 new cases overnight, 3 cases in Port Stephens local government area, 2 are in the Newcastle local government area, 5 from the Lake Macquarie local government area, and 1 from the Dungog local government area. Also on the Central Coast, 15 new cases on the Central Coast at 8 p.m. last night. Southern Highlands, we saw 5 new cases in the Wingecarribee Shire. 4 of those cases were in Woodlands and 1 case in Mittagong, in the Mittagong area. Southern New South Wales, there were 0 cases to 8 p.m. last night, but we've already been notified this morning. There are 2 additional cases, 1 in Batemans Bay, 1 in Cooma. The Bateman Bay's case is a close contact of a previous case that was announced a couple of days ago. Again, a call out to the community of Forbes. Fantastic result in the past 7 days. They've moved their first dose vaccination rate from 36% to 63%. And again, a call out to regional rural New South Wales is to get vaccinated. Walk-in clinics without bookings are becoming more available right across the region. Jump on the New South Wales website and find out where you can get the jab. Thank you.
Good morning, and thank you very much, Premier, for the invitation to attend today. From the National Centre for Immunisation Research and Surveillance, it's been our pleasure to be working very closely with the Ministry of Health, the Department of Education, and indeed principals, schools, directors and childcare centres, as well as, of course, families and kids, to be able to track the spread of COVID in educational facilities across New South Wales. We've actually been doing this since the beginning of the pandemic in March 2000 last year and delivering reports. Today we're releasing the fifth of those reports, which saw us cover the period from mid-June through to the end of July, 6 weeks, during which there were cases of COVID in 51 educational facilities across New South Wales. Important to note that there are almost 9,000 facilities, I think 3,100 schools and around 5,800 childcares. So of those 51 sites where there was a case, there was actually the majority that did not have any onward spread of the virus to teachers, staff or children in the educational facilities. What we saw was that the highest rate of spread was actually amongst unvaccinated adult staff, and particularly unvaccinated adult staff at the time of the report in childcare centres. The spread of virus also occurred from adults to children, but the spread between children themselves was very low. This really affirms what we know about the Delta virus. We have seen a higher rate overall of spread from the Delta virus as compared with what we saw last year, but in children in particular, the majority of children who have become infected have not had symptoms or had only mild symptoms. And this is certainly the case for the children infected in the educational centres as well. We have seen high spread of the virus in households, including in households after there had been a case at an educational centre, and we know that's primarily driven again by unvaccinated adults. Just a word on the infection in children. We're very lucky to know, and it's consistent with data over the course of the pandemic, that COVID-19 remains generally mild in children. Only around 2% will require hospitalisation, and for many of those 2%, it's actually for monitoring and social care. Unfortunately, often their parents are very unwell with COVID-19, and that's why they're being cared for in the hospital. We've seen extremely few children admitted to the intensive care unit. So I think there's a lot of detail in the report which I trust will very much inform and is informing the work of New South Wales Health and Education and the New South Wales Government in designing their strategies for the return to face-to-face learning in New South Wales. As a paediatrician and a parent, I know how important education is, and particularly face-to-face learning for children's well-being, development and mental health. And families have really been suffering during this time, and children have been having a hard time. But there is light at the end of the tunnel, and it's really being delivered, I think, through COVID safe practices designed in that roadmap to return, underpinned by the evidence and the continuous monitoring that we're doing. And absolutely the biggest shout out from our perspective is for everyone eligible to please be vaccinated, parents, young people, and even teenagers now from the age of 12. Vaccine is available. This is just the greatest measure that we have to protect kids of any age. So thank you.
Professor, did your research look into the issue of airflow within schools and whether children were more likely to catch Delta in a space that has lower airflow? And was there any recommendation made around that?
So we know that ventilation is very important, and that's certainly a key element of COVID safe practices in schools, having where it's possible outdoor learning. Our specific research hasn't correlated that with the outbreaks, but there's a lot more to come as we analyse the data from further weeks, which we're doing every single week and presenting to New South Wales Health.
Premier, on masks then for students and for teachers, Doctor?
Well, I defer to the Premier as well, but I know that advice is in the return to school plan, and certainly from age 12 and above, masks are to be implemented, is my understanding. But also masks can be worn by younger children, and I know that may be required in the future, and it's certainly a strong option for families to consider. And we're pleasingly seeing children come on board and wearing masks. They can do so in a safe way most of the time.
Premier, is your government looking at employing or bringing in changes to school building infrastructure in terms of ventilation? I mean, we still hear about some schools where windows are painted shut, that sort of thing. They don't have great airflow.
Yeah, look, as the Professor has outlined, the return to school plan was done in consultation with our health experts in a staged way, in a very safe way. And obviously in the warmer months, you can have windows open and doors open and improve ventilation. So the plan is very much based on what is a safe way to return to school, to obviously assist in getting us back to normal as possible, but especially acknowledging what a difficult time it's been for families and for children. Face-to-face learning is obviously the optimum way for children to learn, and we are absolutely confident that the plans that have been put together in consultation with our health experts and education do have that safe return to school. We have outlined details of that plan already, but obviously as we get closer to that date, if there are any tweaks that need to be required, they'll be implemented. But as we've said, these plans were put in place in a very detailed and consultative way, in a staged way, to make sure it's safe for all concerned. And as Professor McInerney outlined, the safest way to protect children is to have high vaccination rates amongst adults and obviously adolescents. And that's why we have had a very strong focus on making sure as many adults as possible are vaccinated, to make sure all of our teachers and school staff are vaccinated. That is the best way to protect children and the best way to prevent the spread in any school setting. But also, as we've heard, 51 out of thousands and thousands of settings isn't a large number, but we know that when it's your school and your child, what that could mean, and that's why we're doing everything we can to prepare the safest return to school as quickly as possible.